Welcome to St. Anselm College. Welcome to our St. Anselm College Family Orientation. This evening is our third session of the series for family orientation. This session is being recorded. The focus of this session is on the important residents' life and health services information. All of the sessions are designed to help families support their new student through the transition to St. Anselm College. My name is Jean Couture. I am the Director of Student Engagement and Leadership, as well as the Vice Chair of the college's new student orientation program. I will be your moderator for this evening. This session will be recorded, as I mentioned, and recordings will be available within 48 hours of the session on the college website under the new student orientation page. We encourage participants to use the Q&A feature to submit questions. We will get as many, we will get to as many questions as possible during the session. If you have individual questions, we encourage you to reach out via email to one of several emails that will be shared during the webinar. This evening, your panelists are Maura Marshall, Director of Health Services, and Dr. Susan Weintraub, Assistant Dean of Students and Director of Residential Life and Education. One last opening piece of information. The college is currently planning to open as close to what has historically been known as normal. Please encourage your student check their St. Anselm College email frequently over the summer, as the college email address is the official and primary mode of communication the college will use with your students. So please encourage them to do that. But without further ado, I now invite Maura Marshall, Director of Health Services, to present. Welcome, Maura.
Hey, Jean. Welcome to everybody. Welcome to St. A's. I'm just gonna put my PowerPoint up here. Okay. There we go. Okay, so I'm here today to kind of give an overview of what support services are available on campus, and also to talk about what forms the student needs to provide in order to enroll or take part in move in onto campus. Oh, and now I am not able to advance my slide. Let me try. There we go. Okay. Sorry about that. It wasn't advancing, but here we are. All right. So Health Services is located right in the Jean Student Center, right next to or down the hall, I should say, from the bookstore. We best operate as a walk-in clinic. Unfortunately, last year we had to take appointments and we couldn't be a walk-in clinic, but this year, like Jean said, we're going to be trying to go back to as normal as possible, but we would encourage appointments to be made just so students aren't waiting in the waiting room. But we would like to operate as a walk-in clinic, and we're most efficient that way. We're open Monday through Friday, 8 to 6, and Saturdays from 12 to 4. We do offer, it's like an urgent care. We can provide medical care. We have nurse practitioners available, nurses. We have a doctor that comes in twice a week. We can do allergy shots while the doctor's there. We can check for strep throat. We can give some TB tests and some immunizations. We can do urine dips. We have a lab, so we can send labs out if need be. So everything is right there at Health Services, and if not, we can refer students out. We also provide counseling under the same roof. Counselors are available Monday through Friday. We have 4 counselors available, 2 counselors on per day. And again, we do recommend that an appointment be made for a counselor, because those appointments do book up pretty quickly. But if it was an urgent matter, we could always squeeze a student in. We also oversee health education. So we do provide CPR classes, yoga. We help facilitate an EMT course. lots of different health education programs on campus. We oversee the alcohol education and lots of other programs on campus that we partner with different departments for. We do, when health services is closed, we do have an EMS team that goes on call at 6 o'clock, and they are fully certified, licensed EMTs, licensed by the state of New Hampshire, and they respond to all 911 calls. They're a great group and they're always looking for help. So if there's any incoming students that are EMTs or would like to become EMTs, please just contact me and I can direct you to the right people to join that great organization. The fee for health services, I put in quotes, is free, but it's because it's covered under the student's room and board. So to students, it is perceived as free, but we do not bill insurance. We don't charge a copay. Like I said, students can just walk in and it's covered under the room and board, and that's for medical and for counseling. So as Jean also mentioned, students, the first thing students should be doing is being connected with their St. A's email. That is how we communicate with all students. And it also is the way they can connect with their health services portal, which is called Medicat, and also the alcohol course that I'll be talking about that they have to access. So they will need to have access to their St. A's email in order to get into those portals. So health forms that are due, like I said, the best thing to do is to get into this medicatconnect.com, register for an account. All the health forms are due on July 9th, and there is a health history form that students need to do right online. They can do that through the portal. And then there's a few forms that need to be uploaded. So we do need to have, the students need to have a physical within 1 year of the start of classes so that they can upload that. It can be either our form that we provide or the doctor's form. We also need a copy of their immunizations and a copy of their insurance card. The only exception to that is for varsity athletes. The NCAA does require them to have a physical within 6 months of tryouts. So certainly if there's a student athlete that had a physical within a year, but not within 6 months, so that means that insurance won't pay for 2 physicals in 1 year, definitely reach out to me or to the athletic trainers, and we can set them up for a physical, so that please don't pay twice, or please don't pay out of pocket for a physical if your insurance won't cover it. The other thing that Division II athletes do need to have is a sickle cell, either a test for the trait, sickle cell trait, or they can complete a waiver if they don't feel that they're high risk. So again, if there's any athletes that have questions about physicals or the sickle cell waiver, please reach out and let me know. I'm happy to guide you through that. If a student is going to need medical housing accommodations, please contact myself or Sue Weintraub, Dr. Weintraub, or anyone in Res Life as soon as possible, just so that we can, housing assignments will be coming out soon, and we do need to know that as soon as possible. And just so you know, air conditioners are a medical housing accommodation. So if there's someone that has a health condition that requires an air conditioner, again, please reach out as soon as possible. So I know you probably heard this if you tuned into the student financial services portion of this, but health insurance is required at St. Anselm College. Most students are covered under their parents' policy. We really do have a very small portion of students that enroll in the student health policy, but it is a great policy. It is available. It is, it goes from August 1st to August 1st. This year, we've negotiated a rate of just over $3,000, but every student will be charged. Oops, sorry about that. every student will be charged for that health insurance. And if you do not need the health insurance, you do need to go online to waive the insurance. So there's a link there, www.gallagherstudent.com. You waive the insurance and that $3,000 will come off the tuition. If you would like the student health policy, then you do need to enroll in the insurance. So again, if there's any questions about that policy, please reach out and I'm happy to answer any of those questions. As far as privacy goes, other departments on campus do have a blanket, maybe FERPA policy where students can go in and sign a form saying that they're giving their parents permission to disclose any academic information. But with health services, it's a little different. We have really double the privacy for students. We are covered under FERPA, but also we're under the HIPAA umbrella because we are healthcare providers. So I know that everybody's familiar with HIPAA because you go to the doctor or go to the hospital or the urgent care. But how it works in health services is that every time a student comes into health services, they sign a two-way release giving permission to release that information to whoever. So if they would like their parents to be able to talk with us and release information, their coaches, their professors, whoever it is, every time they come into health services, they have to sign a two-way release for that particular issue. We don't have a blanket HIPAA form that's available like a FERPA form. So the other thing that is required is we do have an alcohol course and a sexual assault program that is mandatory for each first year student to take. It takes about 2 to 3 hours. There again on the admissions portal, it's very detailed instructions on how to get into that course. It starts tomorrow, so they can start working on it tomorrow. They can work on it through the summer, but the first part does need to be done before they move into campus. So there's the alcohol course and there's a consent and respect course. So there's 2 courses that need to be completed before they move in. And then there is a part 2 of the alcohol prevention course that comes in October. So they'll get a reminder that they need to complete part 2 in October. So again, they need to watch their emails and make sure that they complete that course. If they do not, the Dean of Students does fine them $100. So we don't want to fine anyone. We want them to finish the course. So just encourage them to start that as soon as possible. Okay, so students with health concerns, like I said earlier, we can provide allergy shots. We have a doctor that comes in twice a week, and when he's there, we can give allergy shots. We just ask that the student come with their serum to the campus and also to have their allergist fax us orders. But we can certainly give allergy shots right on campus. Students with asthma, I do recommend that they bring their own nebulizer. We do have them in health services if anyone needs them, but again, health services does close at 6 o'clock, so they may need access at night. So please bring your nebulizer if you have asthma. If you're on daily medications, students, I do recommend they bring a lockbox just because unfortunately medications have disappeared in the past when other students don't really know what they are. So lock those daily medications up. If a student needs to refill prescriptions on a monthly basis, we do have lots of pharmacies around the area. We have Hannaford, we have Rite Aid, CVS, Walgreens, Walmart, and students certainly could transfer their prescription to the local pharmacy, or usually students do go home about once a month, so they should be able to keep their prescriptions at that pharmacy. But if it's a new prescription or you're from out of state and the student needs easier access or doesn't feel comfortable leaving campus or have transportation getting to the pharmacy off campus, Rite Aid is the pharmacy that does deliver prescriptions, and they deliver them right to health services. And if there's any students that would like to have their prescriptions delivered on a monthly basis, then just contact us. We can help them fill out the paperwork and get that set up with Rite Aid. We do also have a flu clinic scheduled for October 5th. So if everyone can write that down on their calendar, I get that question a lot, but we will have a flu clinic right on campus October 5th, so students can receive flu shots right on campus. So again, what to bring to college this year. So trying not to mention the C word, but there is a big difference between high school and college, and that college campuses are very similar to cruise ships. We do kind of link them to illnesses spreading very quickly, just like cruise ships. Droplet to droplet, we've had outbreaks of the flu, obviously, norovirus, MRSA, we've had mumps in the past. So I do encourage students really to bring their own cleaning products, disinfectant wipes. They should bring their own thermometer, though we do have those available if needed, hand sanitizer. And again, even with COVID, the flu, students should have a plan for quarantine or isolation if they get sick. It's always good to think ahead. So our community, again, referencing the cruise ship, our community does consist of 95% of students do live on campus. So we are a communal living setting. We do have monks who work in the classroom, they work in our offices, and they live on campus. And many students and employees who are immunocompromised or have to go home to family members who have chronic health issues. And we also have people who are not medically able to receive any vaccines. So last year, a lot of planning and preparation went into bringing students back to campus during a pandemic. And we never want to do that again, honestly. But it does take the entire community to work together to make that happen. So again, just to kind of look at a snapshot of our campus, college-age students were a group that had the highest number of outbreak and transmission rates of the COVID campus. The kind of turquoise dotted line is college-age students, and we definitely saw that on our campus. So I just wanted to give you a snapshot of what campus looked like through the eyes of our students. So this is, our students have an Instagram meme page, and these were some of the posts on the Instagram page. And COVID really did cause a major disruption in their college life, as you can see. They had to wear masks all the time. We all had to wear masks. We did surveillance COVID testing right on our campus. We built a COVID lab right in our hockey arena. So students were coming at 7 a.m. for COVID testing. No guests were allowed on campus. There was no intervisitation. Students really couldn't gather in groups. Most of the programming was done virtually, though we did have the opportunity for in-person classes and remote classes. And students at one point needed permission to leave campus. So again, this caused a lot of anxiety. Some students really felt isolated, and some students really dealt with depression. So we really don't ever want to have to go back to this again, and want to just bring attention to the stress that students were under, thinking that coming to campus was going to be normal, and it just wasn't last year. So we're doing our best to change that coming up. So last year, we did actually have 327 students that tested positive for COVID and did have to go into isolation. And we had 919 students quarantined due to being in close contact with students with COVID. So obviously, due to looking at these means, students really felt very restricted. And by the end, I'd say, well, by the middle of spring semester, COVID fatigue really did set in. Students were really tired of wearing masks, tired of quarantining, tired of the 7 a.m. testing. And I mean, some of our student athletes had to quarantine up to 4 times. So they were just done with COVID. So basically, our goal, I mean, our students just want everything to be back to normal. And our goal for the fall semester coming up really is to return to our pre-COVID campus life. The only way to do that really is if we establish herd immunity on our campus. And vaccinations are the best way to do that. So far with our upperclassmen, we have 54% of our students have provided me documentation indicating they're fully vaccinated. So we're getting there to a good amount of herd immunity. And at this point, our administration is strongly encouraging students, faculty, and staff to get vaccinated. And we are monitoring data regarding the vaccines and our campus immunity before they make a decision on whether to require the COVID vaccine or not. So at this point, the college is strongly encouraging everyone to be vaccinated as soon as possible and to provide that documentation to me so that we can really assess our herd immunity and our campus community. So I think I'll pass it along to Res Life, Dr. Weintraub, but if there's any questions, I'm sure I will be available to answer at the end. Thank you.
Thank you very much. I am just working to share my screen appropriately, so I can do that. I've also been asked, thanks Maura, hopefully you can hear me. I've been asked to remind folks that we will answer questions at the end, and if you do have questions, please make sure that you're putting them in the Q&A and not in the chat area. And someone's going to be moderating the questions. I will try to be brief because my actual favorite part of these webinars are the questions, because I think the questions really illustrate where everyone is. And I think a lot of people have the same questions, certainly about Res Life. So I will try to run through my presentation quickly so we can get to as many questions as possible. And just like Jean said and Maura said, it's really important for students to use their SANES email, and anytime that's referenced. If folks do have questions, please email Res Life or email me personally, and I'd be happy to answer what you have. So generally speaking, the Department of Res Life is called Residence Life and Education. And the reason it's called that is we provide a living learning environment that is exactly that. We spend a lot of time thinking about how students live and how to be able to do that in community, but also providing a residential curriculum that is a home away from home, with opportunities for folks to start to learn how to balance social connections within that academic living learning environment. We are not the only folks on campus providing that out of classroom education, but students certainly in the first year spend a lot of time in their res hall, getting to know people, learning how to be able to study where they need to study. They're doing all that exploration. And we do a lot of, interacting with them to be able to have them balance that well. One of the things we do and talk about a lot is the transition from what high school looks like and classroom time and social time, and what that looks like in college. Because if you think about it, a lot of it's really prescribed. Students go into their school, they're in classes most of the day. They might pop in and do a little bit of homework at that time. After school, they're working. They might be doing athletics, working out, and doing homework, obviously, and then they go to bed, maybe sometimes. So, and then they start the same thing. But once they get into college, the classroom time really shrinks. They're in lecture a little bit. Sometimes days are different. Monday, Wednesday, Friday look different than Tuesday, Thursday. And that social time, they have to figure out how to balance that and do a good job. We spend a lot of time working with how to adjust to that and how to be able to do that well. And we have an experienced, excellent professional staff who helps students, but also the department run to be able to do that. Our professional staff, we have an associate director, Mike Murphy, an assistant director, Ryan Ford, and the very important professional live-in staff made up of area coordinators and resident directors. Our resident directors, heroes in the first year buildings, they're trained, as the area coordinators are, in student development and communication, how to be able to mediate roommate conflicts. As I said, the adjustment, transitions, crisis management, what laws are applicable in higher ed, what policies are important on campus that we help to enforce, building management, and obviously campus resources. We do not do this alone. We have an excellent student staff made up of our resident assistants. We have 58 of them, and there's a 40-to-1 ratio student to RA, which is actually very, very good. They're selected, they're trained, they're evaluated yearly. And in the first year area, they really do concentrate, and we do a lot of training with them over the summer, how to be able to have difficult conversations, how to be able to mediate things. How would a first year student need and know to adjust and transition to what it is to live in community? And then what campus resources do they need to have that they just don't know are there? And RAs really are the first contact for students. They live right on their floor. They're interacting with them. They are, part of the community, and they're really the first contact. I always include this slide, and I feel like I always want to add more to it, but then I don't, and remind myself we've got a lot of information on our website. So I would say go to our website. We've got an excellent list of what to bring, what not to bring. Again, if you have questions, feel free to email me. I'm happy to answer what that is. We have a virtual tour done by 2 previous RAs that go into a room in JOA and a room in Dominic Hall, and really run through, this is where I put this is your closet. I mean, they really run through the whole thing. It's really an excellent virtual tour. And in addition, if you come to campus or already have, coming to campus, please jump on a campus tour to be able to see exactly where and what the residence hall and a room would actually look like. Biggest question I get, I skipped over, I don't even know why, because I get it absolutely all the time, and it makes sense, right? You need to know what the sheet size is, and it's so confusing. But anyway, we are a 36 by 80 campus. We are twin XL. So when you head off to wherever you're going to buy your sheets, that's really what you want to look for. I always put this, and I had to remind myself when I sent my kids to college, is less is more. And you may want to take some time, student and family, to determine what really is important in certain months. So if you live close enough, you may not want to bring everything with you. That can feel overwhelming when you're packing the car. Take my word for it. You may want to decide, okay, well, we can bring that, when the weather changes. If you don't have that luxury, and I didn't with one of my children, less is more, and you can ship and you can send and you can do a lot of different things to be able to get what you need to your student. But I would say wait until you actually know what they might actually need. Our first year areas with singles, doubles, triples, and quads, students can live in any number of those situations. Women live in Joan of Arc Hall. They live in Alumni Hall, otherwise known as 2nd and 3rd Street. And then overflow, we have some sophomores and first years in Baruti Hall. Our men usually live, and next year will, in Dominic Hall. It's one of our biggest residence halls on campus, and they'll all fit in Dominic Hall this year. Another big question, roommates. Of course it's a big question, right? How do you match roommates? And I get this question anytime anyone finds out that's what I do in life, is residence life. How do you match roommates? We really do take a look and match by hand using the housing information form. At this point, I just looked I think on Friday, I only had 36 students in the first year class not fill out the form. So many people have. We're going to be outreaching directly to those 36 to remind them to fill out the form, because we really do use that to match. We don't like to take roommate requests, and frankly don't. We find that the first 6 weeks of living together with someone that you just don't know, that isn't a sibling and isn't your family, we really do really well with that, what I call honeymoon period of, learning how to communicate, excuse me, learning how to communicate well with each other. We do that well and have conversations about with individual roommates in situations of, okay, how do you want your room to be used? What are the things that are important to you? We have those individual conversations with RAs and those two roommates to be able to do that. And another reason why we call ourselves, Res Life and Education is part of that is learning how to be able to live with people in community and learning how to do that. Usually when I have this webinar in person, I'll ask people, does your student have their own room? And most of the time, everyone's raising their hand. Do they have their own bathroom? There's a lot of people that do, or at least, a kid bathroom. You know what? They're not. When they get to college, they're going to be sharing a lot and learning what it's like to live in community. And part of that is the education that happens in the first, I would say, 6 weeks of school. The other thing I would ask is social media. Take it with a grain of salt. You're going to get your roommate, as Maura Marshall mentioned, you'll get your roommate around through your email, but around mid-July, you'll get that notification in your email as to who your roommate is and how to be able to contact them. You're going to jump on social media, aren't you? Everyone is, the whole family. You're going to gather around your computer and you're going to take a look at what this person looks like. And you know what? 9 times out of 10, that person really does not kind of present in real life what they're putting out on social media. It's just what we find. I get a lot of phone calls from parents about how on earth could you have matched my son, my daughter with this particular person. I will most of the time ask to speak with the student, and a good portion of the time, students like, I'm just going to go and meet my roommate and see how it goes. And that is what I would suggest to do. And certainly if there are issues, we can work them through, and I've had people move, but generally speaking, it's really important for people to give everyone a chance. College breaks, I put this in. Yes, you have to, come back to campus and maybe get your kid during the holidays. So fall break is the only break. We don't really close our res halls. Thanksgiving we close, Christmas, Easter, spring, and over the summer. If students need to stay on campus for some reason, they just have to contact us and we'll try to make arrangements to figure out how to allow that to happen safely. Really quickly, I have some pieces of wisdom, not that I'm the sage on the stage, but I feel like I offer this information and I offer it, and it's really from years of experience. Research shows one of the most significant indicators of success, and this isn't just for college students, this is for K through 12, all the way through college students, is if a student can ask for help, is a great indicator of whether or not that person will be successful in what they're doing. So I would suggest and really strongly urge them to ask for help. And help is for anything. Help is, where is this? Or how might I do this? I'm having trouble with this. How can you help me? That's what we're all here for. That's what student affairs is for. How to be able to promote and encourage kind of that independence from family and be able to start making decisions and doing things and advocating for yourself. But that's a great indicator of whether or not you're going to succeed. And then the last thing I would say is seek out campus connections. Is there someone, it could be a work study supervisor, it could be a faculty member eventually, it could be your RA, it could be your AC, it could be someone in student activities and leadership, it could be any number of people, but who is your person? That's what I would say as a parent to my kids when they come home, like fall break, Thanksgiving. Who is your person? Who is your campus resource that is an administrator, a faculty member, a staff member that you can go to get that help, whether it be, about campus resources or classes or where is the nearest ... Who is your person? And I included this in my webinar last year for the first time, and it was kind of adorable because I said, if you don't have a person by this particular time, I will be your person. And it was adorable because I had people coming out of the woodwork saying, will you please be my person? So again, I'm very happy. And there are many people on campus who would be your person, but I would say try to figure out who that is. And again, I'm happy to do that. So Jean, I'm going to put this over to you because I think I'm set with my presentation, and I will stop sharing at this point.
Great. So folks, there are a few questions that have come in. I'm going to get to them. I'm going to quickly share my screen though to share some email addresses that folks had asked about. So can everyone see the email addresses there? I hope. So I'm gonna leave that up for a second, and then I'm gonna quickly, while you guys are looking at that, oh, I actually can't get to questions while you're doing that. Hopefully that is enough time for folks to see those. Okay, so one question that was asked is, can you use bed risers with the metal beds in Joan of Arc? The answer to that is yes, you can use bed risers, and it's encouraged because it creates more space underneath the beds and for the room itself. Can the beds be moved around? Sue, I hope you don't mind. I'm just going to quickly, if I know it, I'm going to just answer to quickly move us through some of these. Can the beds be moved around the room? Yes, residents can rearrange the furniture in the room as they so desire. Can a Wi-Fi router be attached to the data port in the room? It probably can, but likely you don't need to. We have campus Wi-Fi throughout the campus and all the different buildings, and we've increased it over the years, so it is supplied well through campus. I believe those are the ones that you may have gotten a written answer, but I wanted to make sure I said them out loud to the group as well. And here you go. So are you, Sue Weintraub, this question is for you. Are you still only filling double rooms for fall, no triples or quads?
I'm filling true quads and true triples. I'm not putting 3 people in a space for 2.
Okay.
I think that's the question.
That would be my understanding as well, yes. This is another one for you, Sue. What are the dimensions of the bed again? Twin XL, including the vertical space under the bed? I'm not sure what that.
Okay, that's fancy. So the dimensions are 36 by 80. So that's what you want to look for. You want to look for that sheets that would fit that mattress. And then the vertical space under the bed most of the time is about 1 foot, give or take. So it's really not the really thick under the bed. It's a little thin. That's generally speaking.
Okay, don't mute yourself because I believe you're going to, I guess my answer to this next question would likely be no, but I'm going to let you officially answer it. Yeah. Can you add a headboard to the bed?
So there are some fancy headboards that, in my own knowledge, that you can strap on like kind of a quilted thing. I've seen that, but generally speaking, if it can strap on, great. But that would be the only headboard that really would work.
Okay.
If that helps.
Okay. Maura, we're going to switch to you for a few questions. Is my daughter able to store extra diabetes supplies in the health services office?
That's possible. It's not usually necessary for students who are diabetic, which we do have quite a few on campus. I do recommend that they have their own mini fridge. So that is a medical housing accommodation, because usually there's only 1 fridge per room allowed. But if there's a diabetic, they may need their own refrigerator for extra supplies or snacks that they really just need and don't want to share with their roommate. So that they would just have their doctor write a letter stating that it's medically necessary for them to have their own mini fridge. The other thing I recommend for diabetics while we're on the subject is that they, if they need a sharps disposal container, we do have those in health services. So they don't have to worry about that. They can just stop by health services, pick that up, and then at the end of the semester, just bring it to us and we'll dispose of it. But that's usually what the diabetics need. But if there's any specific needs that are unique to that student, just have them reach out to me.
Great. I'm going to stay with you, Maura. Do we need to send a copy of our child's proof of COVID vaccination card to health services?
Yes, so that, yeah, that can either be, I mean, I do recommend that they get into the Medicat portal, and that is, they upload a copy of their vaccination card. But if they have any trouble with that, they can just always email it to me, that's fine. But yeah, as soon as I can get those proof of vaccinations, the better idea we're gonna have about the COVID immunity on campus too.
Great. And that answers another question that somebody asked, which is, it sounds like uploading that vaccination form is part of the forms that they'll find on the portal, that the students will find.
Exactly.
Great. Sue Weintraub, back to you for a second. I believe you answered this, but I'm just going to let you just say it again, clarify. How many girls in a JOA room?
So most of JOA are doubles. I think I have one triple in JOA. So most are in doubles. I think I only have 2 singles, and most of the time there are folks that need to be in a single in JOA.
Okay. Is the follow-up question to that, is there a way to request a double? And I assume versus
a triple or quad? You can. I mean, we'll place people randomly, but you can.
Okay. I'm going to answer this one. What is move-in date? We haven't discussed move-in yet. I anticipate it will be Thursday. Sorry, I'm going to my calendar, folks. I anticipate it will be Thursday, August 19th, but that has not yet been determined. So more to come, and that's why we've asked your students, please, to be checking their college email, because those messages about move-in will come in. If anything, I would foresee it may be the day before that. Certainly, I don't see it being later, but right now, aim for Thursday, August 19th. More to come as soon as the college makes a decision. I'm going to go, Maura, where can we find the waiver for the sickle cell trait?
That would be in the athletics portal. So the student athletes, it's just for student athletes, and it will be they have forms that they need to fill out for athletics, and it will be through their portal. So certainly they should reach out to their coach or athletic trainer, and they can guide them in that. But if they have any difficulty, they can reach out to me and I can direct them.
Okay, we're going to stay with you, Maura. When you listed that daily meds are to be in a lockbox, would that apply for daily vitamins and Zyrtex?
I mean, that's just a suggestion. It's not mandatory. Again, if you're, it's definitely not necessary. But if someone if they're on a stimulant or have, medications that they really don't want to risk disappearing, again, they're not in their own private room or their own private, home, that they are sharing a room that is just for their own benefit. So no, it's absolutely not necessary.
Okay, I'm going to start by answering this, but Maura and Sue, both of you may want to jump in. How can I get help / accommodations for my child with an eating disorder? Both health services, but also our dining services is very good about working with our students. So I would also encourage your student, to get over to dining services, and talk with dining services about what their needs might be. But Maura and or Sue, I mean, I'll start with Maura. What would you want to add to that?
Yeah, I think the best thing is for the student to have a conversation with their doctor, nutritionist, or healthcare provider, therapist, and come up with a list of medical accommodations that they need. Have those providers write letters. And then we actually do have a nurse practitioner in health services named Karen Zellers, who works with all of our students who have eating disorders. So certainly get the paperwork into me and to Sue if there's any housing needs due to the eating disorder, and we can work directly with the student. But what I would have them do is make an appointment to meet with Karen Zellers on move-in day, so that the student and the family can understand what support's available right off the bat.
Okay, Sue, do you have anything to add to that?
I don't think I do. I mean, most of the folks, I mean, students with eating disorders really do work, as Maura said, through health services and dining services to be able to accommodate what their needs are, whether it be certain hours, certain needs of particular food, particular time, how to be able to access. So, everyone's needs different. So just like Maura said, just try to get some information over to health services as to what, and we'll certainly do what we can do.
Great. Maura, we're going to stay here with a few more questions. You mentioned that the student needs to complete the medical records. Would this be from birth is the question, all the way through complete medical records? Can you define that maybe better?
No, we don't need complete medical records. What we need, there's a health history form that the student fills out themselves online. So they're filling out their information themselves, and we need a physical within the year, and we need a copy of their immunizations. So we definitely do not need their medical records from birth.
Okay, great. After folks have uploaded the health forms on the portal, how long does it take for it to show with the green checkbox on the completed list?
Oh, that's a really good question. It's not automatic. Health services, we have our own portal because it's very private. We're the only ones that see that information. So that information does not communicate to the admissions portal. So I'm the only one in the office for the summer. So we have nurses that come in, and we will be going through every single student's chart to make sure that their information is complete. And if there is anything that we're missing, you'll be receiving a postcard or a follow-up from us way before you move in. But yeah, it's definitely not automatic with the green check with the admissions portal, because it's two very separate things. We do try to give a list to admissions so they can put the green check mark on, but it's not automatic.
Okay, thank you. Sue, we're going to jump to you for a few questions.
Mm-hmm.
Is there a TV mount in the rooms, or do we supply one, or are they allowed?
There is no TV. So no. TV mount, no. We don't supply them, and please don't put them up.
There we go. Okay. Can we rent a refrigerator through St. A's, or do we have to purchase one?
We do not do refrigerators. We did at one point, and there were so few people that really wanted to rent. So no. The one thing we do request is not to do that micro fridge sort of thing, because microwaves in the first year res hall, we do in a very common, most of the common areas. We also provide Keurigs, so every person doesn't have to bring one. It's an effort to be sustainable, not an effort to be really anything else but that. So if there is an accommodation that needs to happen, meaning, I need to be able to heat up my food without it being in a common space, that is an accommodation. But generally speaking, the microwaves are there. The fridge question, just, bring your own and work it out maybe with a roommate, because we really only allow one fridge. Unless like what Maura was talking, someone with a medical need to have their own fridge with medicine in it, that's an accommodation. Yeah.
Great. Someone asked this, and I hopefully I'm answering, I guess, what you're looking for, but it says, how would you go about obtaining all of this information? And basically, your students have access to what we refer to as the portal. So it's an admission portal, enrollment portal, I should say, an enrollment portal. And in there's lots of different, I guess, documents, but there is what's referred to as a new student guide, I believe is what it's called. And a lot of this information will also be in that guide that was developed. I hope I have the correct name, but your student has access to this. And if it makes you feel more comfortable, sit down with your student and have them show you everything they are seeing and help them walk through it. I know some students are self-sufficient and just take care of it. And I know others might want a little bit of hands-on from their folks a little bit more, but your student does have access to this. They can log in and get the information. If there's something I'm missing from the question and the way you asked it, please just feel free to ask some, I guess, a little bit more specific if there's something else you're looking for. So my son is having an annual physical the first week of August. Should we have our provider fill the form out based on last year's physical and then update once he has the new physical? Maura?
Oh, yeah, they can submit last year's physical and definitely the immunizations from last year. And then as soon as he gets his physical in August, just upload it to the portal and just, just let us know that the date of the physical, so we're not badgering you. But as long as they have it before they move in, we're happy.
Okay. So you might have a better answer. The question is, where does one obtain bed risers? I go to Bed Bath and Beyond, or maybe even a Lowe's, or where else do you suggest?
They have them on Amazon. They have fancy bed risers now also with, USB and all this stuff. I mean, really, you can almost get them anywhere, but you're absolutely right, Jean. I've gotten them at BB and Beyond. I've seen them on Amazon, Home Depot, Lowe's, you got it.
Target, Walmart,
Yeah,
all
I mean,
those.
really, they're everywhere.
Okay.
And they're everywhere in
Right.
about another month when you start seeing all that horrible word dorm things, because that's a word we just don't use.
Okay. So I'm not sure we're going to have this answer. Well, we'll come up with a good answer here. My son tried numerous times to fill out the housing form. He is not able to. He has reached out to the help desk. He has tried to get an email copy of the form. Will you be reaching out to him by email?
We should be, but what I would say is send me a direct email. Have him send me a direct email or to the Residence Life email that Jean had posted before. And to make sure that he's filling out the form, I can email him a copy or see why for some reason he's not accessing it. Don't worry about that. But yeah, have him contact us and we'll get him the form.
Great.
Easy.
Thank you.
Yeah.
If I'm hanging curtains in the window, how tall should they be approximately?
So every house is different. Every rest hall is different. And I have no idea where I'm placing your student at the moment. So, and I don't know who you are. So that answer, wow, that's a toughie because, Alumni Hall streets, the windows are huge if you're a female. Dominic Hall, they're kind of normal. So I would say the length would be 63 or 72. Joan of Arc has really weird windows that kind of crank out. So that's a really weird question. I think I would wait until you find out which res hall it is. And then again, email me the question and I might be able to give you a way better answer.
Great. So this is my last, remember folks, to put any questions into the Q&A. I'm on the last one, but I'm going to give it a minute for others to add questions if needed. I assume the boys' dorm can use the bed risers as well. Yes, they can certainly use the bed risers as well.
Yep.
So is there anything, Sue, Maura, that you want to add before I kind of give some closing remarks?
I think I would add one thing, and I thought of it as I was looking at, and I'm going to add it actually to my presentation for years to come, because it's something that I talk to individual parents about. When a student goes to college, you may want to check your homeowners and homeowners insurance as to what's covered, their computer. Sometimes folks get renter's insurance just to cover them, or have a rider on your homeowners if something happens to something that they're bringing with them, especially valuables, things like that. It may be something you want to take a look at. Some people are comfortable not doing that. Some people are not comfortable, and really that's something to be helpful and do.
Maura, anything you want to add?
Actually, that just triggered a memory of mine too. There is, if you have a student that's a little fragile, has chronic health conditions or mental health issues that you're not really sure how they're going to do the first year, there is tuition remission insurance also that I usually mention in my presentation too. So that is, you can find it on the Student Financial Services website or webpage, but that is also an option for students. But also if anyone's coming to campus tomorrow, we'll have a booth. I'll be there. And if there's any specific questions about your student that you have that you don't want to put in the chat, I'm there, or I can take any of the health information if you want to bring it with you.
So folks, I'm going to, I believe we got to all the questions this evening that you folks had. But if you have an individual question, don't hesitate to reach out to one of the emails that was shared throughout this presentation. We are here to help you and your student, encourage your student to reach out as well. We really do encourage, and you'll hear this Wednesday night a little bit more from me if you join us for Wednesday night session, but we really do encourage the student to be the doer and you to be, I guess, the support person. So really get your student to reach out with any questions that they may have as well. As a reminder, tonight's session was recorded and recordings will be available within 48 hours of the session on the college website under the new student orientation page. We do look forward to seeing you at our next family session, which is Wednesday, June 16 at 6 p.m. The topic is student engagement and the student perspective. So I look forward to seeing folks on that evening as well. Let me just make sure. One last question, sorry. Do you recommend we have a healthcare proxy for our student? Maura, do you recommend they have a healthcare proxy for their student?
I mean, it's entirely up to you and your family. Obviously, if there is an emergency, we would be contacting you. In almost 100% of the cases when we want to communicate with parents, the students have no issue with giving us permission. And like I said, we're not, we're not billing insurance. So it would be in case of an emergency if they had to go to the hospital. But again, I think we have a good relationship with our local hospitals too. And we would be providing the hospital the emergency contact information too. So again, it's up to you. I'd say about maybe once a year, we have a family fill out a healthcare proxy, but I've never really seen it like an issue at all.
Thank you, Maura. Thank you everyone for joining us. Go back to the recording or reach out to any one of us. Join us on campus tomorrow afternoon. We would love to see you on campus. And the next session Wednesday night at 6 p.m. Thank you so much. Have a wonderful evening.
Thank you.